Good morning, good evening, good afternoon to wherever you're from. My name is Terence and Praveen, and I am joined here today with Luthfan Adam. The two of us will be explaining the psychoanalytical theory. So, the psychoanalysis is actually one of the many therapies that aim to release pent up or repressed emotions and memories in a client to achieve healing. In other words, a goal of psychoanalysis is to bring out the unconscious to the conscious. This is achieved through communication with other people about life's biggest questions, things that matter the most, and questioning it and diving deeper into the complexity hidden behind the plain surface. Now, the founder of this theory was none other than the famous Sigmund Freud. Reason being was that Freud was interested in the unconscious mind and this spurred the development of some of his most influential ideas. Freud created the models of the mind, and he named it Freud's models of the mind. This phenomenon is quite simple as it consists of three layers. The first layer is the conscious, the second layer is the preconscious, and the third layer is the unconscious. The first layer is of the conscious mind. It means that it is things that we are thinking of right now. For example, what to eat, where did I park my car, what time will work, and etc. The second layer is a bit deeper than the conscious. It's the preconscious, which is basically part of the mind that we aren't thinking of at the moment. But once we have spoken about this, the memory is then retrieved. Like, where is my blue shirt? Who is at home right now? These are things you don't constantly think about, but once said or asked, you're able to recall it. And the final layer is the unconscious mind. This is a bit tricky as this part of the mind is the deepest level of our mind. This is the place where most of our past memories or traumas are repressed to, hidden well underneath the surface of both these layers in the conscious mind, and can hold a lot of pain, and these pains can actually surface out in forms of anxiety, anger, and sadness. Freud also developed a more grounded structure for models of the mind, something that can coexist the base idea. This model has three parts as well: the id, the ego, and the superego. The the id operates at the unconscious level. The id is basically a child. As a child doesn't think of the consequences, they only act upon what they want. And the id is all about the wants. Moving on, the second concept, which is the superego. The superego is where our morality resides. This is where our social responsibility takes place. Our higher principles and morals exist. Think of the superego as the older sibling and the id as the youngest child. Now, keeping that in mind comes in the ego. Now, the ego is like the parent. The ego checks up on the id, and the superego tries to satisfy and tries to satisfy both of their wants in a more socially and acceptable manner. If a person is in the middle of class and the id is hungry, the id would just be irrational and leave the class for food, or worse, even steal the food from someone else. The superego would then come in place saying that stealing food is bad, but the ego is the mediator to prevent these unacceptable behaviors from taking place. Therefore, the ego will rationalize with the id and compromise with the superego with having food immediately after class. Now, I will pass it on to Luthfan Adam to explain the psychoanalytical theory further.
As humans, we face a lot of conflicts in our journeys, right? Wait, we're all humans here, right? Well, when we face a little too much conflict in life, we tend to develop defense mechanism, as Freud believed that when the conflict is too much for a person to handle, his or her ego may engage in one or many defense mechanisms to protect the individual. These defense mechanisms comes in 6 different variations like repression, denial, projection, displacement, regression, and sublimation. The first defense mechanism I'll be talking about is repression. Repression occurs when the ego pushes disturbing or threatening thoughts out of one's consciousness. Next is denial. You can often hear people say, "No, Bob, you're in denial. Being 5 foot tall does not mean you're tall." Denial usually occurs because the ego blocks upsetting or overwhelming experiences from awareness, thus causing the individual to refuse to acknowledge or believe what is happening. The third defense mechanism would be projection. It happens when the ego attempts to solve discomfort by attributing the individual's unacceptable thoughts, feelings, and motives to another person. As university students, I think we can all agree when I say we face copious amounts of stress, and we all deal with it differently. However, with the regression defense mechanism, the individual moves backwards in development in order to cope with stress. For example, you can catch overwhelmed adults throwing a tantrum exactly like a child. The next two defense mechanisms are quite similar, so pay close attention, alright? Displacement as a defense mechanism satisfies an impulse by acting on a substitute object or person in a socially unacceptable way. For example, Bob goes to work and has a bad day. Therefore, he takes out his anger on his dog or wife when he returns home. However, with sublimation, this defense mechanism involves satisfying an impulse with a substitute object, but it is done in a socially acceptable way. So instead of Bob taking his anger out on his dog or wife, he channels that energy into a constructive hobby like watching football. Have you ever wondered what caused our emotional and behavioral problems during adulthood? Well, Freud hypothesized that an individual must successfully complete all five psychosexual stages of development in order to become a psychologically healthy adult with a fully formed ego and superego. If one stage isn't completed, individuals may become stuck or fixated in a particular stage. The first stage of psychosexual development would be the oral stage, which starts from birth until the child is a year old. This is the stage where the child seeks pleasure from the mouth like sucking. When this stage is incomplete, it may lead to later oral fixation in life like smoking or nail biting. The second stage occurs when the child is 1 to 3 years old, and this stage is called the anal stage, where the ego has developed. This is when the child seeks pleasure from the anus. During this particular time, how well potty training goes for little Timmy here will determine his personality. There are two different scenarios little Timmy could end up in. If potty training goes well, he could very well be anal retentive, whereby he would dislike messes in very tidy and is respectfully or authority. However, he could also be anal expulsive, where he grows up to be a rebellious, messy, and disorganized individual. The third stage begins around 3 years old to 6 years old and is called the phallic stage. This is the time the superego is being developed. The libido is focused on the genital area, the penis or the clitoris. Discovery and manipulation of the body becomes a major source of pleasure. An example would be masturbation. Naughty naughty ah. The fourth stage, also known as the latent stage, occurs when the child is 6 years old, up to puberty. During this stage, the child has little or no sexual motivations, as most sexual impulses are repressed. This is also the stage where new skills are being developed and new knowledge is being acquired. Finally, the last stage would be the genital stage. It begins from puberty and into adulthood. Timmy would be slightly grown up by now, and this is when adolescent sexual experimentation begins. Individuals would start to seek pleasure from the penis or the vagina, aka sexual intercourse.
Now, you guys remember Sigmund Freud, right? Well, Freud's work was continued on by a former student named Carl Jung, whose brand of psychology is actually analytical psychology. Now, it's the components of psychoanalysis. It has interpretation, transference analysis, technical neutrality, and counter-transference analysis. Wait, hold on. Let's look at it step by step. Interpretation is where therapists and clients communicate verbally about their hypothesis, about their client's unconsciousness. So, interpretation is divided into three categories. The first category being clarification. This is basically a technique used by therapists that tries to figure out what is going on in a client's mind. The second category is confrontation. This is pretty self-explanatory. As the name says it all. It's essentially where the client confronts or pays attention to the non-verbal parts of their mind. Then finally, the last one is interpretation proper. Now, this is where the therapist actually creates a hypothesis of the unconscious meaning and connects all aspects of the client's communication with one another. Moving on. The next one is transference. Transference is when a client projects his or her feelings from their childhood onto somebody in the present. A very common example that you might have seen in movies is where a person sees the same characteristics from their father in their bosses. Now, don't worry. Later on, Adam will explain what transference is in more in depth. But I'm not gone yet. So let's move on to the third component of psychoanalysis, technical neutrality. Technical neutrality is when therapists approach their patients with socially appropriate behavior, and not only that, but the therapist really focuses on the patient's life and never mentions about their own life. But You've probably heard of some situations where therapists never really listen to their patients, but only tend to give advice to them. Now, this is called counter transference. This is where the therapist projects their own personal problems and feelings onto their patients without actually having any boundaries. In easier words, countertransference is when the therapist offers advice instead of listening to a patient's experience. Now, I'll pass it on to Adam to talk more about transference, like I said before. Bye bye.
Earlier just now, Terence has explained what transference is in the components of psychoanalysis, and I'm here to talk about it even more. Transference is one of the many forms of resistance considered in psychoanalysis. In psychoanalytic theory, resistance has a specific meaning: the blocking of memories from consciousness by the client. Transference occurs when clients redirect their emotions and feelings from one person to another, often unconsciously, and represents a resistance of obstacles between clients and their desired state, also known as healing stage. It is frequently occurs in treatment in the form of transference onto the therapist, in which the client applies their feelings and expectations towards another person onto the therapist. There are four different types of transference. The first being paternal transference. In this type, the client looks to another person as a father or idealized father figure. Next would be maternal transference. The client looks to another person as a mother or an idealized mother figure. Siblings transference occurs when parental relationships break down or are lacking. Instead of treating another person as a parent, the client transfers a more peer-based relationship onto the other person. Lastly, this is a more general type of transference, which is also known as non-familial transference. The client treats others as idealized version of what the client expects them to be, rather than what they truly are. This type of transference can lead to the client to form stereotypes. Thank you guys for watching this slideshow. Now let's test your memory, shall we?